Hello everyone, hello my Chinese colleagues. My name is Nicoletta Colombo. I am from Milan. I'm a gynecological oncologist working at the European Institute of Oncology in Milan, Italy. It was my great pleasure to present at the plenary session the results of our study. Is ENGOT OV65 Keynote B96. This was a prospective randomized phase 3 testing the addition of Pembrolizumab to weekly paclitaxel with or without bevacizumab in patients with platinum-resistant recurrent ovarian cancer. The study included 640 patients around the world from 187 sites in 25 countries. And at the interim analysis 1, we were able to demonstrate that the addition of Pembro to weekly paclitaxel led to a statistically significant and clinically meaningful improvement in progression-free survival in the population with the tumor expressing PD-L1 according to the CPS score of 1 and higher, but also in the intention to treat population. So we met the primary endpoint, which was progression-free survival in the CPS 1 and higher population and also in the intention to treat population. So the median progression-free survival was 8.3 months in the Pembro arm and 7.2 months in the control, in the placebo arm. But I think even more important are the results of the interim analysis too, because with 27 months median follow-up, we were able to demonstrate a statistically significant improvement in overall survival in the CPS 1 and higher population. This is the first time that a trial in ovarian cancer has demonstrated an improvement in overall survival with the addition of immune checkpoint inhibitors. The median overall survival was 18 months in the Pembro arm and was 14 months in the placebo arm. And I want to underline that this difference of 4 months is particularly important because it's relative to a control arm which was really very highly performing. These are the main results of our study. I can only also say that the treatment was very well tolerated. We did not observe any unexpected adverse events. So the conclusion is that this is a new standard of care for patients with platinum-resistant recurrent ovarian cancer. Yes, in our study, we left the use of bevacizumab to the choice of the investigator. And this is because we know that there are patients who are not good candidates to receive bevacizumab, and actually there are contraindications for the risk of bowel perforation. So for that reason, we did not mandate the use of bevacizumab, but we left it to the investigator choice. However, I must say that more than 70% of patients receive bevacizumab together with Pembro and weekly paclitaxel. And if we look at the forest plot, we could not see actually a difference in the efficacy and in the effect in progression-free survival and in overall survival according to the use of bevacizumab. So the benefit was observed regardless the use of bevacizumab. I think this study is very important because, as I said, this is a new possible standard of care in patients with platinum recurrent and resistant ovarian cancer. And so I think this regimen should be taken into consideration in all future trials, investigating new agents, particularly I'm talking about the new ADCs coming. And I think this should be taken into consideration as a control arm for any future studies in the patients population with platinum-resistant recurrent ovarian cancer.